society that's going to run for 7 years. And so we're actually going to be looking for postdocs to join that centre, which is exciting. So I'll have a few more people to add to my team then. And I'm actually part of establishing that centre right now. It's got 18 chief investigators and 8 universities around Australia. So it's a massive thing. There's lots to get going, but it's all very exciting. And I'm actually leading the health focus area. So I'll be doing a lot of sort of ethnographic and innovative methodologies around how people are experiencing and imagining automated decision making in the health context. And just as another bit of background, I'm trained as a sociologist and sort of did some anthropology as well. And then I went in and did some public health training, Master of Public Health, and I did my PhD in the Department of Public Health. But it was on a very social and relevant to now topic. It was on HIV and AIDS and how the Australian press reported HIV and AIDS from the early 80s to 1990. Some interesting historical changes over the reporting of during that period, using Foucauldian theory, because that was sort of an era where Foucauldian theory was very much interesting and hot and innovative and new back in the early 90s. But now, well, more recently, I've been moving on to using more than human methods and theories, and of course now with the COVID crisis, there's many interesting and important topics for social researchers to be researching right now. So that's why Adele and I thought it might be good to talk about that and focus on that topic today. So Adele, next slide, please. And I'll just get right into it. So, there we go. So more than human theory is the term that I prefer. I don't like, so there's kind of alternative terms like post-human theory, the critical post-humanities, new materialisms. But I actually prefer more than human theory because I think, for example, post-human has so many different meanings and uses as a term in theory and applied research that I think it's actually it can become less than edifying to kind of use that term because it does get a bit muddied and used in so many different ways. So I actually prefer this use more than human theory, which I think is pretty clear in terms of explaining what the interest is. And I think also it's really important to emphasise that Indigenous and non-Western cosmologies have been more than human basically forever, for millennia. And that's often left out of a lot of the Western writing on new materialism or post-humanities, those perspectives. And rightly, there's been a critique from people working in Indigenous and non-Western cosmologies and saying, well, so-called new materialism is actually very, very old materialism if we take this more than human perspective. So I've been trying to read a lot more about that kind of philosophy, the non-Western Indigenous and First Nations philosophies and how they understand the human and the more than human and the interactions between these agents in the world. And then I've also been really, in the last few years, really sort of inspired by feminist new materialism. So Haraway's work, Bradody's work, Barad's work and Jane Bennett's work. So in my recent writings, I refer to those four in particular, those four philosophers in particular. I've been using Haraway's work for a very long time because, of course, she's been a very significant figure in feminist technoscience. And her manifesto for cyborgs was a really important philosophical piece ranging from the late 80s. But it's more recently, I suppose, I've been engaging with the other three feminist new materialist philosophers. Next slide, please. So the key concepts that I am finding really interesting and important to work with more generally and also in relation to COVID-related research are these. So the idea from Barad on onto-ethico-epistemologies, the idea that you can't separate ontologies from ethical issues from epistemology. So ontologies meaning what things are, how we experience things. Ethical is self-explanatory in epistemology, how we understand the world, how we learn about the world. They all are interrelated, and that's something that I really try to keep foremost in my own research and writing, because I think that's a really crucial concept from more than human theory. Then the idea of more than human assemblages. And assemblage theory, of course, has a fairly long lineage in continental philosophy, particularly the work of Deleuze and Guattari. And a lot of the feminist new materialists are building on that work. And because they're feminists, they often have more of a political stance than some of the Deleuzian assemblage theorists. So again, I like that. I mean, Braidotti, I think I really like her writings about affirmative ethics and how people using more than human concepts can actually work towards not just critique, but also imagining new ideas and new directions for human flourishing. And again, in this COVID world, we need that more than ever, because so many people are suffering, and for all sorts of different reasons, not just health-related reasons, but in terms of the changes to their lives and to their economic circumstances. Distributed and relational agencies is also an important concept, and that is the idea that as humans, we don't possess in ourselves agencies that are pre-existing. The agency or the power to move, to understand, to learn about the world is always developed with and through our engagements with other humans, but also with non-humans. Agential Cuts is a concept from Barad's work, and that is the idea that whenever anyone, but also including social researchers, whenever any human is trying to understand the world, we always have to make a decision about what we consider to be important from the plethora, the sort of, non-infinite ways that we can understand phenomena. And as a social inquiries, we're constantly making agential cuts in terms of deciding what it is we're going to be focusing on and excluding other possibilities. So that's always something to bear in mind too when we're doing our works of social inquiry. Vitality's think power. Now, think power is a concept used by Jane Bennett in her work. She's a political philosopher, and so a political science. So she talks mostly in her work about environmental politics. But what I've been trying to do with the concept of think power in recent times is to try and apply it to digital technologies, because that's been an area of research I've been working on, well, really since the 90s actually, but I've returned to it in even more detail because in the last probably 7 or 8 years, because of the way that the digital has really come to be part of our everyday lives, even more so than back in the 90s. And for example, I've written an article about the think power of apps and trying to understand digital media and devices as having, when we're using them, when we're coming together as an assemblage with an app or with a mobile phone, or even with the old style desktop computer or with a wearable device, this is an example of more than human assemblages, which are generating for us various agencies as we come together with these devices and with these media. And as an example, apps, if we use, say, a health-related apps, an app for health or fitness, for monitoring ourselves, for learning about our bodies and our activities and our body functions and health states, then there are various agencies and capacities and what could be called think power, vitalities, livelinesses that are generated when we use those apps. Sometimes vitalities might be closed down when we use apps. So various ways we have for understanding our bodies and our feelings and our physical sensations actually might become colonized by the learning about our bodies that are generated by the app, which is often a very metricized, quantified way of thinking about our bodies and our health and our fitness. So that's the kind of issues that I've been trying to talk about in my work on the think power of apps. And I also talk a lot about that in my book, The Quantified Self, as well. Affective forces, so the idea, again, there's quite a Deleuzian underpinning to that, but there's also from the 16th century philosopher Spinoza. He has really influenced a lot of the feminist new materialists, and his work very much talks again about how agencies and capacities are created and distributed when humans come together with non-humans as well as with other humans. And these include affects. These include forces that compel us or move us in certain directions or in certain ways. And again, the idea is these affective forces are shared. They're distributed between the agents in assemblages. Relational connections is something that I've also been trying to spend a lot of time looking at when looking at how people are engaging with digital devices and digital media. And when I use the term relational, I'm talking about this notion that we are relating to other people. And, you know, in the COVID world, that has become, again, more crucial than ever, as we are doing right now in this assemblage of a PowerPoint and in my case, an iPad, in your case, various other digital devices, and the humans that are listening in and this human who is speaking. And, you know, the desk that I'm sitting at and whatever you're sitting on right now, unless you're standing. But we are forging some kind of relational connection through this assemblage of all these different agents coming together. And these relational connections, again, might open or close off various capacities. So I then talk about agential capacities at the bottom of this list. So what do these connections, what do these affective forces, what do they enable us to do? But also, again, what do they close off? So in this case, this assemblage of me talking to you in this format, it is opening up the opportunity for me to communicate with you to communicate with me, to generate some questions later perhaps for me that I can then relate to. But it's obviously closing off a lot of things too, compared to, say, me being there at the Gold Coast with people in a room and being able to see the whites of your eyes as well as you being able to see mine, and having that more embodied interaction that an in-person talk involves. Okay, so these are the concepts I've been working with. Adele, next slide, please. Now, post-qualitative inquiry is a really interesting body of social inquiry that's been emerging mostly from education, actually, and particularly the work that's published in the journal Qualitative Inquiry. Really exciting and interesting work that's really sort of exploding the whole idea of how qualitative research should be done and can be done, actually, not just about should, but also about can, and opening up new possibilities. And post-qual inquiry does have a great debt to more than human theory. So it's very much an intersection of theorising inquiry that I think is a really important direction to take with social inquiry. What I've noticed over the time that I've been a qualitative researcher, which is basically since I did my Master of Public Health degree and onwards to the PhD and then onwards into my academic life, which is more than 2 decades now, is that I've noticed qualitative research becoming more and more oriented towards science, scientific methods, particularly in some journals, not in all journals, but for example, I was quite shocked and horrified, to be honest, to see that the journal Qualitative Health Research, which has been around for a long time and has published some really interesting research, phenomenology and such, actually the editors a few years ago made an actual editorial statement saying that they refused to receive any poetic inquiry-based articles for that journal. And I noticed that last year because I actually did some poetic inquiry myself. and it was on a health-based topic, and I was actually thinking of submitting it to that journal. And when I was looking at to see what articles have been published on Poetic Inquiry in that journal, and came across this editorial, which was published a few years ago now, and I thought, what? They were focusing specifically on Poetic Inquiry, no other form of inquiry. It's like, no, we don't want this kind of work, go away. And I thought, what the heck's going on here? But so I was not impressed. Anyway, so I found another journal for it, and it has been published, and so it found a good home anyway. But I have noticed again, particularly with health-related qualitative research, there is this, has been this move towards, talking about reliability, validity, replicability, I can't even say that, how to replicate the research, which takes on a very scientific notion of how research, even qualitative research, should be conducted. So post-qual inquiry is a really refreshing kind of rejection of all that, and basically arguing that we are always research assemblages ourselves, getting back to this notion of assemblage, that we as researchers, as humans, are interacting with other humans, but also with the non-human agents that are always part of our research, whether they be, the interview schedule we've devised. And, we've made agential cuts when we actually even decide what topic we're going to research, when we decide what method we're going to use, when we decide what questions we're going to ask, when we decide how we're going to analyse what we find from our research materials. So there's decisions made from the plethora of options all the way along there, and to try and force that process into a kind of, reproducible mode of science is just makes no sense, because of course there'll always be so-called bias as humans, and that also applies to research in the lab or whatever as well, of course, which Karen Barad talks about very convincingly as well. So the notion from post-qual, anything can be data. So I've read really interesting accounts of how people's breath can be data, how snow and wind and how we experience those, they are data. It really just gets back again to how we make that agential cut about what we're deciding is data. Square quotes, data for the purposes of our research. Another interesting thing about post-qual is there's no fixed methods or cookbooks, but there are sort of concepts to work with and theory to think with, and interesting previous, research that has been published. So in some ways it can be a little bit frustrating for someone starting out, that there's no fixed method, like there is with thematic analysis, like there's many cookbooks how to do thematic analysis, which is very reassuring, but it's also, again, pretty rigid. And the idea that all interpretations are partial gets back to this notion that we are always a research assemblage. We are always making agential cuts when we are interpreting anything, and what I might interpret from my research materials one day, even myself, might differ a few days later when I go back to the materials. So they're always dynamic, they're always changing. And I also really like this more than representational multi-sensory methods approach that a lot of post-qual people are working with. So this idea that, again, that anything can be data, that how we sense the world is a mode of research, and more than representational gets the idea that, sometimes it's talked about in terms of non-representational, but I don't like that, because to me anything is representational. But more than representational means, for me, that we're not just talking about language or discourse necessarily when we're doing our research. We also might be interested in the way that we sense the world, and that might be those imaginaries, those sensory experiences, those kind of barely articulated or difficult to articulate experiences can often be more readily accessed through arts-based methods, for example, or other creative methods, rather than just sitting down with someone and saying, how do you feel? that it might be very difficult for them to articulate that, but using an arts-based method or creative writing, for example. We've experimented with zine making in our lab, which brings together images with words, can often really get at those difficult to articulate aspects of people's experiences. Next slide, please. So for me, so getting back to the idea that there's no real cookbook, but there can be research questions and concepts. So these for me are some of the key questions for people who might want to do a post-qual approach. So how do agents respond to each other? And when I mean agents, I mean humans and non-humans. What effective forces and relational connections are generated? How do the affordances of things come together with the affordances of human bodies? So the word affordance is a term often used in digital media studies, actually, to talk about how objects are designed to invite certain ways of engaging with them by the designers. And that might include how an app is designed, how a wearable device like a Fitbit or a smartwatch is designed. They're designed in certain ways, or even a social media platform like Facebook or TikTok. They are designed in certain ways to invite a certain kind of engagement. But of course, when humans come together with those affordances, we often improvise. We often reject the affordance or ignore it or get frustrated with it. So there's a very complex interactions of human bodies and human sensations with the affordances of things, which I think is really fascinating to explore. And gets back again to what capacities are opened or closed by these engagements and these assemblages. How does matter make itself felt? So when we are engaging with non-human agents, what are the feelings that we have in our bodies? How do these things call out to us? Gets back again to the affordances, how we might operate with, work with, enact these affordances of a thing. And of course, it doesn't have to be a digital thing. It can be something like a desk or a chair. They are designed objects and certain affordances have been designed into them. What are the stakes involved when agential cuts are made? What is excluded? Gets back to this idea that when you make an agential cut, you're excluding all the other possibilities. What are the implications of that, of those decisions? How do we come to affect and be affected? A key question in more than human theory, about, which kind of gets at the way that effective forces are generated and how they circulate. What new modes of being and conditions of possibility can be brought into existence? And I think that gets to some of the questions that Braidotti really likes to focus on. This idea about ethical considerations and going beyond critique to looking at new ways that might contribute to the benefit of humans. Where is difference created and how can things be different? And again, what are the implications for human flourishing, which gets back to the more affirmative approach that we can take in our research if we choose to. Next slide, please. Oh, I just thought I'd mention this one was actually qualitative health research. Despite the fact they weren't keen on poetic inquiry, I did publish something earlier in that journal, so at least they were open to more than human analysis. So I just thought if anyone's interested, what I try and do in this article is give some examples, and so I list some key research questions. I give some examples of different forms of research materials that can be used, and it focuses on digital health, this particular article, but it can be quite relevant to most topics, really. And for example, I just give little case studies of how you can do a policy document analysis, how you can do analysis of interview-based materials, how you can use video footage to do a more than human analysis, and so on. So some people might like to have a look at that article, because it really was an attempt by me to really just explain how to do more than human theory analysis. Next slide, please. Okay, let's get on to COVID research. So, of course, this is a very new topic that's just really emerged for everyone this year, over the past few months. But because I do have a background in researching epidemics, going back to my PhD on HIV and AIDS, and I do have a background in Master of Public Health training in epidemiology and public health. For me, this whole emergence of the COVID pandemic raises a lot of really interesting questions that kind of draws on, decades now of research into the sociology of health, for example. So I've been working really hard to think through the implications for social inquiry and also more than human inquiry related to COVID topics. So some of the things I've been thinking about are, what are the assemblages that are coming together in this COVID world? And some of them are very new assemblages. And I'll talk about that a bit more in a minute. What are the key human and non-human agents involved? And of course, the virus causing COVID-19, SARS-CoV-2, has had a huge coming together with humans. I mean, the agency of this virus is incredible in terms of what's already been wrought by the virus in the past few months all over the world. Talk about thing power. The COVID assemblage, the thing power of that COVID assemblage is incredible. What effective forces, relational connections and capacities are opened or closed by these gatherings? So go into the next slide, please. So getting back to this idea of COVID assemblages. So we have the virus, SARS-CoV-2. We have humans literally all over the world being affected by what's happening with the virus. See, and another really interesting, of course, is the way that the virus did come through to humans from animals, currently believed to be bats or maybe pangolins in the Wuhan wet markets. Of course, there's been many epidemics or pandemics over the past few years that do have a human source, animal source that then moved into humans. But this has been the most extreme example lately. But of course, many people are saying there'll be others after this as well. So very important issue to discuss the human-animal assemblages that are coming together to create these new pandemics and epidemics. Place and space has been incredibly important, as we know. The locales of the pandemic, the different ways that nation states have responded, all the social isolation or the physical isolation, measures that have been put in place, they've actually been quite different across the different global contexts, which is really quite fascinating to see how that's opened up or closed capacities. And of course, in really poor examples like Trump's USA, the way that the lack of stopping the viral spread has caused so much death and illness. Is a really really brings home just the effects of policies around closing down human contacts with each other. And again, there's been so many fascinating examples of how things have been part of COVID assemblages: hand sanitizers, toilet paper, soap that we use to wash our hands as part of our hygiene measures, just to name a few. Lift buttons and how we engage with lift buttons right now. Excuse me. Then sensations that we are feeling in our bodies as we are engaging with new ways of living right now. And of course the affects as well that we are experiencing and feeling, and how all these agents coming together are generating these affects and sensations. I think it's really fascinating areas for us to explore. Next slide, please. So a little project that my Vitalities Lab members are doing is taking photos of our everyday life in lockdown. And these are just some of the photos I've taken in my local area. Just of the signs we're seeing that are telling us how to move our bodies or how to restrict our bodies, and how to relate to other bodies, other human bodies, how open spaces such as playgrounds have been now shut down, and how those things in the playgrounds can't supposedly now, in theory, be touched, particularly by children in the case of the playground. and how that's changed the way children can move their bodies, for example. And of course, these scenes of that we've all seen, I'm sure, in supermarkets of various items just being gone, disappeared from shelves. In this case, this is a Coles supermarket with hardly any liquid soap. So it's not just the toilet paper, it's also liquid soap and things that are disappearing, and flour and all those basics that have been disappearing from shelves and making our everyday choices about how we live in some ways more challenging and difficult. So yeah, we're experimenting with those kinds of visual diary methods to kind of get at the non-representational aspects of how we're moving through our own everyday worlds, just as one example of an interesting approach to how to do this kind of research. Next slide, please. Actually, so this is my last slide because I know it'd be good to have time for Q&A. So, and just before I talk through these resources, I've also come across some, just to give some other examples of what other people are doing in terms of really innovative approaches to understanding the multisensory and affective worlds of the COVID crisis. So I came across a project which was like a smellscape. So asking people to record the smells in the COVID worlds that they're experiencing right now. And for some people, it might be nice, freshly baked bread because they're experimenting with, many people are experimenting with making bread at home right now. For other people, it might be walking out on what is usually a crowded street in a city and finding that there's far less air pollution, and so it actually smells much nicer than before. And it's interesting, having lived through the bushfire crisis here in Australia, in many ways, those areas that were affected with very bad air pollution are now experiencing beautiful weather and clear skies. But not just because the bushfire crisis has stopped, but the COVID crisis has actually contributed to less air pollution. I've also seen another project talking about the soundscape, so asking people to record the sounds of their COVID worlds, including, I guess again, it could be being able to hear birdsong more in a city environment than you were able to do before, and far less traffic noise, for example. There's people writing COVID diaries, so just jotting down their experiences in a journal form, and using that as a research method as well, inviting other people to do that and just to jot down thoughts and feelings about their everyday world. So there's actually a lot of really interesting, innovative research going on right now. And I'm sure there's many other things that we could all be thinking about doing as well. So, so just in terms of some resources that you might like to follow up later. So I have got a Facebook group called Innovative Social Research Methods, and I've noticed that there's been a lot more people joining lately, which is fantastic. So if you're interested in, just as a community, sharing resources on innovative methods, that's a really good community, and it's quite an active community. So I'm just going to cough a little bit. Just all this talking is making my throat a bit dry. Next one is my blog, This Sociological Life, and if you click on any of these links, they will take you to the websites. They're all websites, or you can just Google them if you don't have access to the slides. And I'm very happy for Adele to share these slides after this talk, if people would like a copy of the slides, and they could therefore just go and click onto these links from the slides. So this Sociological Life, I do talk about a lot of my own research and research methods, if anyone's interested chasing up some of those. We have also a Vitalities Lab blog and website where we do, again, talk about lots of different methods that we're experimenting with. At the moment, actually, one of the research projects I'm doing did involve visiting people's homes and doing video ethnography with them and following them around the house while they pointed out what digital tech they were using in the home. And of course, once the COVID lockdown started, we couldn't do that anymore, but we've developed a new approach, which my postdoc Ash has been experimenting with this week. Actually, we obviously got ethics approval to make that change, but so she's doing this sort of virtual tour of the house with our research participants. So they're using their smartphones and basically taking a tour of the house while she's on the other end of the app on her computer and talking to them in real time while they're moving around the house and showing us their devices. So we've had to kind of change our method quite quickly in response to the lockdown situation, which brings me to doing fieldwork in a pandemic, which is a Google Doc crowdsourced resource that I put together about a month ago now, because I was thinking actually about what to do with this project that we were doing, which was very much, going to people's homes and could no longer involve going into people's homes in person. So I just started this document and I invited people to add to it, and it's actually ended up quite an extensive document. I think it's about 39 pages long now, and lots of really interesting suggestions there from lots of different people about doing field work that doesn't involve face-to-face engagements with people, while we're not able to do that right now in this context. So for lots of ideas, if you're interested, check that out. And then finally, this is a blog post I published on the Medium blog, Social Research for a COVID and Post-COVID World, an Initial Agenda. So I just sort of outlined a few ideas for where social researchers might want to be considering the kinds of research that we're doing right now in response to the post-COVID world. And one point I did make in that blog post is that, basically, if you're doing any kind of social research, you are a COVID researcher now, because that is our lives now. We're living in the COVID world, or COVID society is a term I've used in some places as well. We're living in COVID society. It's like Beck's Risk Society, except now it's COVID society. So anything, whenever we talk to people about anything, really, it doesn't matter what the topic is, it's in the context of COVID. So I think that's something we need to bear in mind. So I will stop there, and I'm interested in any questions or comments you might have. Thank you.
Thanks so much, Deb. That was really great. So now I'll just let everybody know that we are recording this, so this will be available afterwards. And you'll be able to see the slides and things as well. So let me just see what's going on. Is that all okay? Yeah. Okay, so now we will take questions. You're welcome to so go into the chat if you want to write them, or just speak up and we can, and unmute yourself if you like. All right, so I see that.
I've just popped one up there for you, Deborah. I thought it might be easy to write it.
Yep, great.
Can we have this modality, writing and then thinking? I'll let you read it.
Can you see Simone's question,
So
Deb?
no, I can't see any comments on my screen. So you might need to read it out for me,
Okay.
Adele.
Do you want to read it, Simone?
Sure. Thank you for your wide-ranging talk, Deborah. That was very good. I'm thinking about what you said about our changing sensory relations with other humans, nature and objects. Lift buttons in particular. I have a horror of getting in the lift. That one was, yeah. So the effective power of these changes. So I'm wondering about how our sense of touch and its entanglement with effects such as fear and pleasure, and how our social greetings and rituals may change as a result of this, and also the design of public spaces in relation to gatherings and flows of people. So it's really this kind of thinking around touching as knowing the world in new ways and how that is changing. And you may be able to see the chat function. If there's a little bar. If you run your cursor over, you'll see a little bar and it's got a range of functions, and there's a little chat function there. It should pop up on the side. And for anyone else who's not seeing that.
So I'm actually doing this on an iPad, and it's not necessary. I have clicked on the chat function that does show up, but I see type a new message, but I can't see any previous messages. So yeah, I'm not.
That's okay. If people type in there, I can read them out for those that don't want to.
So thanks, Simone. Yeah, I mean, there's just so many around. Yeah, touch. You mentioned touch in particular, and I was also thinking when I had a medical appointment before things got really, really full on, and the amount of warning signs around the lift, and various sanitizing and had to go on. Just getting in the lift was, that's one what made me think of the lift example. And yeah, lifts have now become these dangerous places, these dangerous spaces. I mean, there's all these rules about how many people can be in lifts, and not, let alone how you end up touching the buttons on the lift, because of course they're very places that many people touch over the course of the day. So this whole idea of touch, I think, is really, really interesting. And of course, there's the obverse of it is that social isolation is leading to many people actually being touch deficient in terms of relationships with other humans, because they're not able to see people that they might normally have an affectionate, hugging, touching relationship with, including family members, including family members they might be really concerned about in terms of their own health, like elderly family members, and no longer be able to, have that reassurance. The way that funerals and weddings are now operating with very few people in them, and social distancing required at the funerals. I think I've read some really interesting sort of autoethnographic accounts actually of people's feelings about lack of touch with other humans, and in some ways companion animals have stepped in for those who have them to fill that need for touch of a warm body, from what I can see as well. So that's also brings back the animal into the assemblage as well. So yeah, there are many really interesting issues to think about. The way that we move through public spaces, as you say, the different assemblages of other people that we're allowed to do that with, how that might, who knows how that's going to change. It's impossible to predict really because we don't even know when physical distancing will be relaxed yet. No one has yet really experimented with that, and it's still at the moment, touching things that might have been touched by other humans, or touching another human, it just remains a highly risky thing to do right now.
Thanks, Deb. I had a follow-on question with that. I guess it relates to cuts, but the cuts that we make, and that, Foucault asked the question of what is the main danger, and death is a very big danger, of course, but death is not certain with catching COVID-19. And there are a lot of there are dangers with the lack of touch, the touch deficiency, the increased calls to Lifeline, all the mental health issues, that they've had their greatest number ever on Good Friday. And that weekend was really tough for a lot of people because, it's just that idea of being around other bodies physically. And I'm really interested in, maybe your thoughts about feminist new materialism and kind of the embodied methods taking Indigenous or other ideas, like how do we decide what is the main danger? And so this social distancing, is it too dangerous to just hug a friend if it's that one person you're going to see? Like, how do we make these decisions? How are those decisions made?
Yeah, that's really, that gets back to perceptions of risk and trust, and I'm sure we've all noticed. I mean, the other thing is that it depends on what space you're in, how you engage in that space right now anyway, and how much you trust the other people or know the other people in that space. So, of course, the comparing, say, the household, where, of course, everyone is, those who do have household members, they are engaging with, they're not, physically distancing from people in your household. You're not required to or advised to, because obviously you just can't, unless you're in quarantine, but that's a different situation. So it's interesting, I think, to think about in terms of the different spaces and places. So the household or the family group or housemates who share, whatever, partners who share houses with each other or flats with each other, they're a certain kind of assemblage of humans in that certain spatial context. Then, of course, as soon as you move out of the household, there's a whole set of other rules and kind of risk assessments to be made. And I'm sure we've all noticed when we're out taking a walk or whatever to get some fresh air and exercise and to enjoy actually getting out of the house because it can become quite confining and bad for our mental health. This idea that, getting out of the house is really a healthy thing to do for our mental health, but at the same time we have to avoid other humans, or maybe have only one human, but we have to have the social distancing with that one human. And I've certainly noticed the way that people kind of step around each other when they're in public places, and kind of, but also give a sort of, I don't know, knowing look at each other, sort of saying, isn't this silly? But we kind of feel like we need to do this. And I've also noticed that in supermarkets, they have their little marking on the floor at the checkouts to tell you must stand back and blah and blah. But then when you're in the aisles, often people are moving very close to each other and forgetting that they need to keep away. I mean, it's just this constantly dynamic way that we're thinking of space and risk and threat and danger and health. I think that's really where a more than human perspective is just so valuable more than ever, because it's just such a dynamic and vital way of life that we're living right now. We're basically, nearly all the rules have changed about how we should move, how we should interact, how we should touch.
Thanks, Deb. Any other questions?
Yes, it's Narissa here. Deb, just an interesting, you can hear me okay?
Yes, I can. Yep.
Okay. Just an interesting perspective I had in relation to touch. I was talking through chat to a couple of my friends, all of us who live as solo people. And we were talking about that lack of human touch in our lives. I have a dog who I hug frequently, so that's all right. But there was a very cute suggestion that I just wanted to put out there. And it was, when I visit my 90-year-old mum, I am her support person, but we do everything at huge distance. But the suggestion was that you hug yourself and she hugs herself. And in that doing together, hugging yourself, you are hugging each other from that social distancing. And I found that it actually does make a difference. It does actually make you feel as if you are hugging somebody when you're not. And I found that was very interesting. By hugging yourself when you are socially distanced from somebody, you are replicating that feeling of giving and taking of affection. And I just found that a very COVID world thing, that we've developed these shortcuts that we would probably never have done before in a pre-COVID world, and yet we're working out all these ways of satisfying our very human needs in the COVID world.
Yes, that is really interesting. And of course we're also, so that, yeah, definitely sort of, I don't know, a mediated form of touch, in that we're hugging ourselves as if someone else was hugging us. That's really interesting. And I'm also thinking of of course there's various sex parties going online. Speaking of touching ourselves, that seems to have really taken off big time as well. So that mediated sexual expression has become quite popular, from what I've been reading about it at least, and which actually gets back to care workers, and also, massage people have lost their jobs. They can't do their job. Sex workers can't do their job, but all they can do is go to sort of doing cam work, for example, camming work, virtual work. So, sexuality has moved online, but also just banal experiences like people, sharing dinner parties with each other online. So they'll chat and eat together, because of course eating is a very social experience for many people that they're missing out on right now. So there's lots of that. Gets back to affordances and how in this case, for example, digital media and devices have been repurposed or newly purposed to try and make up for that lack of touch or face-to-face interaction that we're no longer being able to do right now.
There's a question from Sue Lovell, Dr. Sue Lovell here at Griffith, and she asks, Deborah, do you make a distinction between emotion and affect in your work?
No, I don't. So I take I take the sort of I guess it's mostly from Braidotti's work, Bennett's work, that affect is a force, which may include emotion. So emotion is sort of subsumed under the idea of affect, but affect means more than emotion, if you understand that distinction. So
yeah, thank you, Deb. It's just, it seems to me it's quite useful to think, like, if we think of affect, as I think Masumi says, as a form, as a kind of intensity, a sort of rawness that's kind of unformed and sort of flows. And then we think of emotion as more kind of culturally produced, an interpretation of affect. It seems to me that in COVID, there's a lot of both. Like, there's a lot of emotional stuff going around about how we should feel or what we shouldn't do and what our moral obligations are socially. But at the same time, there's this kind of niggling, kind of unexpressed anxiety that I think of as kind of more affective. Might be quite an interesting distinction in this particular setting.
Yeah, I mean, there are some affect theorists like Masumi who like to sort of hold on to this idea that this kind of intensities that are pre-verbal, pre-social, and that's how they define affect, which can then move into being into socially labelled experiences, which then become emotion. I personally don't hold to that idea of this pre-verbal, because I actually, as a sociologist, I guess for me, any emotional intensity or affective intensity or force that we're feeling as a force in our bodies is always in a social context. It's never pre-social for me. So right. That's, I suppose, where I might differ from how Masumi might conceptualise affect. I like Margaret Wetherell's, I don't know if you've read her work, but Margaret Wetherell's definition of how she talks about emotion versus affect, I sort of hold more to her approach. So if you're interested, look that up. But yeah, for me,
I'd love to look that up. Yeah,
it's when so affect is always a social cultural experience, distributed between humans and non-humans, never pre-existing, right? It's always generated rather than pre-existing. That's my approach anyway, and other people might disagree with it. And when it is labelled as an emotion, that's a labelling of a certain experience as an emotion. And of course, the way that we label emotions is socio-culturally acculturated. From birth, we learn what an emotion is and what that feeling and how to label a feeling or an affect in a certain way. So yeah, that would be my approach to the distinction.
Okay. Thank you. Do you know where Weatherall's, the reference for Weatherall? I do like her work.
Not off the top of my head, but yeah, just go to Google Scholar.
Okay, yep. I'll have a look.
I did actually write a book called The Emotional Self, where this is sort of pre days of Masumi and affect theory back in the 90s. So yeah, I was engaging with what was then called the social constructionist idea of emotion back then. So it's interesting how, yeah, these theories have changed even since then.
Yeah, it is. And a lot of people really don't like Masumi, but it seems to me that if we're talking about something embodied, the idea of intensity is actually quite a useful one. I mean, I struggle a little bit with Masumi myself because, I mean, particularly that work, which was from 1995, is typical of some of the theory of that time, in that it was, you know, very esoteric and annoying.
Yeah, and
but still, it's the intensity and that intensity and kind of embodied thing really does lend itself to things like fear or confusion and panic.
I think we've got time for one more question. Kaya?
Hi, can you hear me?
A bit quiet.
Oh, okay.
Speak up.
I'll just speak up.
Shout.
Thanks for your presentation, and also I just want to say thank you for that great collection of resources of, you know, doing research at the moment, the fieldwork in a pandemic. I think that's really great. One of the things that I've been thinking about and sort of troubles me in a way is I'm wondering how these new innovative mixes of methods that people are scrambling to uptake, they're being embraced really widely, more so than ever before, by people who haven't necessarily worked in areas of creative, participatory, sort of sensory modes of engaging with participants. So I wonder how we ensure, or at least are critical of these methods that we're all using, that we're not taking advantage of our participants and people at a point of time where there's a lot of trauma, grief, uncertainty, and because of this really complicated reshuffling of social inequalities, particularly for us here in the West. And I just wonder what your thoughts are about how in the future this boom of innovative mixing of methods is going to look and how we're going to be on top of critiquing this for the ethical considerations.
Yeah, that's a really good question, really important issue to think about, absolutely. I mean, certainly, just to give an example of the field work we were doing that we had to suddenly change to a mediated form, we thought carefully about that. And one thing we decided to do was just, you know, we did put it in the ethics modification form just so we knew we had approval to go ahead with doing the field work, the home visits, using an app, using a smartphone and an app, streaming app. And then we just thought we won't try and recruit people straight away, you know, because that was actually in the middle of you know, social distancing and rules and about isolation and such happening, people losing jobs and such. So we certainly didn't want to encroach on people's space while they were coming to terms with the new way of life that we're all going through. So we gave it a while, and we only just started this week. What we are finding, and you know, in this case, it's obviously people who've volunteered to do this kind of work, and it's in some ways not as challenging a topic as some might be. We're not talking to them about their job losses or anything. We're just saying, look, what devices are you using in the home? So I think the topic is crucial. If you are going to be talking to people more about, you know, yes, their experience of unemployment suddenly, or their experience of worrying about their elderly relative, that's where we really, you know, particularly need to be very sensitive to when would be the right time to do this kind of research. And I'll just give another example. So another project I'm on with a team, quite a large team from my Centre for Social Research and Health that I'm part of at UNSW, we had for months been putting together this online survey well before COVID erupted about trust in medical information. And we particularly wanted to target marginalised groups because we work with a lot of those groups and have done for a long time in our centre. So people with HIV, sex workers, people who inject drugs, you know, people with hepatitis, you know, those kinds of very stigmatised out groups. And we were particularly interested in what they had to say about whether they trusted the way that their medical data and their health data are recorded, say in My Health Record, for example. Because their views haven't really been, you know, elicited. So we got a privilege to do that, and we're all set to launch the online survey and recruit by Facebook. And then, of course, COVID came up, and then we had to sort of think, is this now a good time to be doing this? And should we be adding some questions about COVID? So what we did is we did add a few questions about COVID, which has now become incredibly important because of this contact tracing app that's been proposed by the government. And people being worried about privacy there. We added a few questions related to that, and we did decide to launch it this week, but we did hold off for quite a while. But what we're finding is that people really want to talk about these issues. They've got views and they want us to know them. So, yeah, I mean, there's obviously a lot of, you know, and I think it will actually document really important issues from these often unheard of groups. And give them a voice. So yeah, I mean, there are obviously a lot of ethical issues to consider, and each project has to be weighed up, I think, based on those issues when deciding about how to proceed and when to proceed.
Thanks so much, Deb. And unfortunately, we've come to the end of the session, so we don't have more time, but it's been really good. And I feel like there's so much more to keep talking about and ideas to explore. And yeah, so hopefully everyone can keep talking, maybe look up some of the references. Don't hesitate to get in touch with me if you've got any further questions. And yeah, and thank you for coming. It's been great to get, you know, so many diverse people here. And hopefully we can bring Deb up at another time and we can talk about, you know, how things have progressed and, you know, just talk a bit more in depth for those of you that are really interested and want to learn more. So, yeah, and thank you to the Griffith Centre for Social and Cultural Research for hosting. And I hope you all have a great day.
Thanks Adele. Thanks, everyone.
Thank you.
Bye.